second, third, fourth, through each one, and we will understand well what's meant by it. First, system change. What do we mean by system change? What we need to understand about system change. Since system change is actually a vital component in all healthcare facilities. Why it is a vital component? Because it provides the necessary structure that allow the healthcare worker to perform hand hygiene, that allow the healthcare worker to do hand hygiene. So what is this? First, sink availability. Sink for hand wash should be available in all clinical settings. We are going to deal with patients in the clinics, in the vaccination rooms, in the phlebotomy area. We should have sink as apart from infrastructure. Why? To facilitate doing hand hygiene. And this sink needs safe water supply. It should also be available. Antiseptic disinfectant. I should have this disinfectant and single-use paper towel, tissue paper. We need disinfectant and tissue paper. These disinfectants inside dispensers. Dispensers show containing antiseptic detergent. I use it for hand wash, and I need paper towels or tissue single use to dry my hand. Then alcohol-based hand rub. These items we talk about of system change. We have to understand that the system needs all of these things: safe water supply, antiseptics, dispensers, alcohol-based hand rub at a point of care. This system change, I have a tool to assess it. We can use the infrastructure survey, for assessing this system change. Who will do this survey? The persons are responsible for implementing this survey are members from primary healthcare team for implementation of infection control strategies. The teams, the members, they have to do it. When they have to do it? In the month of October. So it will be done yearly in the month of October. Then this survey will be filled and submitted to the head of the primary care in the corresponding health region through the proper channel. What we are going to assess in this survey, what we already mentioned about the availability of the things, the availability of the water, running water, clean water supply, the availability of disposable single-use towels or tissue paper, the availability of alcohol-based hand rub at point of care, the availability of boosters and educational material beside alcohol-based hand rub or beside the sinks. The persons are responsible for replacing the empty dispensers. All of these items, it's an easy items, and it's very clear infrastructure. It's very clear its questions, and we can go easily through its questions and answer them. As we agree together, the persons who are responsible for filling this form, members from the primary healthcare team for implementation of infection control strategies. This is the first item, or the first pillar of the hand hygiene promotion program in Kuwait, and that will be implemented in the primary care. A second issue, or a second pillar of our program, training and education. What we need from education, all the healthcare providers in the primary care should get a full training and education on the importance of hand hygiene. What is the 5 moments? The correct procedure of doing hand washing and hand rub. We introduce this training is very important. Why? To help in behavioral and cultural change and ensure that the healthcare worker are able and convinced to do hand hygiene according to its indication. So the competence will be deeply rooted and maintained by continuous education program. So each facility, each primary healthcare system will establish their program of education on hand hygiene to provide regular, continuous training of all healthcare workers, the new and the old people. We mean all those previously trained, Those previously trained, we have to give them updates and the refreshing course. Those new will be trained on what? I'm talking about hand hygiene and hand hygiene program. Because after training, we will check the competency as we will see later. This is number 2. We have many material can be used for training and education. You can go through it, and you can go through our website, Infection Control Directorate. There is also package for e-learning. You can go through as an educational material. Also, these are educational material. These are posters available for hand wash, for hand rub, for 5 moments. All available. You will find it everywhere in your clinic. Still, we are in the area of hand hygiene promotion program. We already talked about 2 elements. This is the 3rd element, evaluation and feedback. Evaluation of the feedback, actually, we evaluate the infrastructure as we talk about it, infrastructure survey. We evaluate the knowledge of the healthcare worker about hand hygiene. We evaluate hand hygiene compliance. Regarding the knowledge survey, we have knowledge survey to assess the knowledge of healthcare worker regarding hand hygiene program. This knowledge survey, who is responsible for conducting it or carrying it on is infection control nurse of the region, infection control nurse. She will do it annually. We already determine sample size for each region and each area. The sample size will be determined. Then this form, our hand hygiene survey, knowledge survey, will be filled by the infection control nurse, will go to Infection Control Directorate for calculation and statistical analysis. After we do analysis, we have a conclusion and feedback. It will be submitted to primary healthcare centers. Why? To do improvement plan that should be developed by the team of the primary healthcare for implementation of infection control strategies. So here, the infection control nurse will do it. Infection Control Directorate will analyze it. Feedback will be given to the primary healthcare centers. And in the primary healthcare centers, the team will study these reports and do a plan, improvement plan for the results that's submitted. This is the sample size we collected and calculated. Still, we are here in the 3rd element of the, or 3rd component of the hand hygiene promotion program in Kuwait, and we are going to talk briefly in details about hand hygiene compliance monitoring. Hand hygiene compliance monitoring, we are going to evaluate the compliance of the healthcare worker to hand hygiene. Who will do it? Again, members of the team of the primary healthcare who are responsible for implementation of infection control strategies. And it will be done to all areas, as we will mention later, and will be submitted to the head of the primary care unit in healthcare region, also through the proper channels. Let us to start with hand hygiene observation. This is the 2nd objective of the lecture, and we will see how we will do it, who will do it, the setting at which we will do it, the timing, everything related to, and the form, details of the form. This is to remind you about the 5 moments. 5 moments is our base. We have, and it's mentioned in details in the first hand hygiene lecture, we have to understand that we have 5 moments. The first one before touching the patient, 2nd one before doing clean or aseptic procedure, 3rd one after body fluid exposure risk, 4th one after touching the patient, 5th one after touching the surrounding. Whether the patient in a chair or whether the patient on the bed, these are the same 5 moments. Why we need to observe hand hygiene practice? Simply to determine the degree of compliance with hand hygiene practice by healthcare workers. Why also? To identify the most appropriate intervention for hand hygiene promotion and education and training program. So when I determine the compliance and the degree of compliance of healthcare worker, I can understand the areas for improvement. How can I improve any deficiencies? And we have to also to report the results. When I do hand hygiene compliance, I report it to healthcare workers, the workers with me in the healthcare facility, in the clinic. Why? To explain to them the current practice. What is their practice? To highlight the aspects that need improvement, and to show them also the possible improvements if I am comparing, if I am doing it and first time and then second time, I am comparing my results. If there is improvement, what is the area of improvements if there is improvement? How we will do it? We will use the direct observation method. The observer should understand well how to assess hand hygiene or how to observe hand hygiene. They should be trained. There were workshops about this hand hygiene, and there is training conducted previously about this observation form, how to use it in our directorate. And we have to understand that the observer will not interfere with the ongoing work. When you are going to observe hand hygiene for the doctors and the nurses in one of the clinics, you are not going to interfere with their work. What they are doing, you will not interfere. And you will keep also the identity for the healthcare worker you are assessing or observing confidential. You will not write their names. And we have to put in our mind that we have our base in the 5 moments, hand hygiene 5 moments that I mentioned previously. This one. This is our base. We have to understand well and memorize them well in order to assess the practice, hand hygiene practice during observation. This is the form we will use. Full details and instructions in the back of this form is available. There is many crucial concepts I have to understand before I start to observe hand hygiene. First, healthcare activity. What is meant of healthcare activity? It's a succession of tasks, of actions, during which the healthcare worker hands can touch different surfaces. So the healthcare worker, while doing his activity or his tasks, he can touch the patient, can touch patient body fluids, can touch surfaces, can touch instruments, can touch patient surrounding, can touch healthcare environment. So the healthcare worker during work or during our routine activity or during our work examining the patient or doing different tasks, I have the potential, or I am not having the potential, I am touching different surfaces. These surfaces, including patient, body fluids, surrounding, environment, and instruments. So each touch or each contact, there is potential contamination of the hand. So the hand, my hand potentially become contaminated because of my activity or during my activity or during provision of patient care. There is another term named indication. Indication, it's the reason to do hand hygiene. Why? Is the indication of the time at which I have to do hand hygiene. Why? It is justified by risk of transmission of infection. So indication, let us to understand, it equals the 5 moments. Indication equals the 5 moments. Hand hygiene 5 moments. If I did contact 1 or 2, 3, there is different indications. Then I have a term named opportunity. Opportunity is the moment when hand hygiene should be done. Opportunity is the time I have to do hand hygiene. Opportunity is necessary to interrupt the germ transmission. So during my work, during these successive tasks or activity, I touch as a healthcare worker different surfaces. So potentially my hand become contaminated. So there is risk of germ transmission. This risk of germ transmission should be interrupted by an action, hand hygiene action. The time at which I'll do the action It's the opportunity. The opportunity, the time I should do hand hygiene. Why? To interrupt the germ transmission of the hands. So hand hygiene action, I'll do hand hygiene, whether hand wash or hand rub, correspond to opportunity. Opportunity is the time I have to do hand hygiene, which corresponds to the indication. Indication, why there is indication? Because I touched surfaces, I touched the patient, I touched body fluids, I touched the surrounding. This is the indication. Again, indication in the 5 moments. Opportunity, the moment at which I have to do hand hygiene to interrupt the transmission. Hand hygiene action correspond to each opportunity, and many indication or several indication, multiple indication can create single opportunity. We will understand this more in the upcoming slides. So here I have risk of transmission. I have indication. Indication create an opportunity. Opportunity should has an action. Let us to go different scenarios from which we can understand what I am saying. The doctor examined one patient. Let us to see. Doctor examined one patient. When finished, he leaves the patient and shake his hand. So the doctor finished his task with the patient, shake the patient hand. What he should do? He should do hand hygiene. This is one of the moments. This is one of the indications. This is indication of hand hygiene is equal one of the moments after touching the patient. So I have after touching the patient, this is an indication. I have to do hand hygiene, but here unfortunately he missed it. And we will see how we will fill the form. I put here he has an opportunity, he has a moment at which he should do hand hygiene after touching the patient. Then he has this indication after touching the patient, then hand hygiene action, hand rub or hand wash missed. This is simple. Let us to make it more complicated in a scenario 2 between 2 patients. This is the same doctor. He examined the patient X. He finished. He shook the patient hand. Then he went to another patient and greet her by shaking hands. So I finished the first patient and I went to another patient and I touched the other patient. I touched the first patient and I finished. And then without doing any hand hygiene, I touched the other patient. So what is the key message we have to understand? I have here 2 indications. 2 indications after touching the patient. This is the first one. And the other indication before touching the other patient. So I have 2 indications here. I have 2 moments here. But how many hand hygiene action I should do? It's one. One action. And this one action corresponds to one opportunity. So I finished here with this patient. I should do hand hygiene and go and examine or touch the other patient. So this is what's meant by different indications or several indications and one opportunity, and which is justified by single action. Here missed. Let us to make it more clear. The same example, but here more clear. This is the first patient. I examined the first patient, or I shook his hand. I finished with after touching the patient. Then immediately I went to the other patient. If I didn't do hand hygiene, I missed here hand hygiene. So I missed one opportunity. I missed one action for 2 indications. So I have 2 indications. One indication after touching the patient, one indication before touching the other patient, one opportunity here, and one action here missed. So I can transfer infection from this patient to this patient easily. If I fill the observation form, this is the doctor, and this is the opportunity. I have only one opportunity. I need only one action to be done, but unfortunately he missed it. And the indication after touching the patient, after he shook the hand of the first patient, and then went to the other patient and shook the hand, he missed both. So missed. missed hand hygiene action. Let us to go another scenario. If we have two persons examining or assessing the patient, I have one doctor. He put on his gloves and then opened the mouth to examine the throat or the mouth of the patient. Actually, he put the gloves without doing hand hygiene. So hand hygiene action missed. As we understood the general idea, using gloves will not replace hand hygiene. If I am using gloves, I have to do hand hygiene before wearing them, and then I have to hand hygiene after taking off. Gloves will not replace hand hygiene. So here it's considered it's missed action. Missed action before clean or aseptic procedure. This is missed by this doctor. The nurse come into the room with a trolley, and she performed hand hygiene by rubbing. So she did hand hygiene before touching the patient. So the nurse here did the action, the hand hygiene before touching the patient. The doctor here missed the action before aseptic technique, although the doctor is wearing gloves. Gloves will not replace hand hygiene again. Here, this is the observation form we'll go through thoroughly. And this is the nurse. This is the doctor. This is the indication for hand hygiene. The nurse, before touching the patient, she did hand rub. The doctor, before aseptic technique, he wear gloves, but he didn't do hand hygiene, so he missed the action. Still unsafe practice he did. All of this to come through to calculate the hand hygiene. What's meant by calculation of hand hygiene, or what is the formula we are using? We simply divide the performed hand hygiene actions on the required hand hygiene actions. Or in another way, the performed hand hygiene actions on the opportunities. The performed actions, whether this is hand rub or hand wash, on the opportunities, the moments at which we have to do hand hygiene, and multiplied by 100. These are the forms described here in details. We have to fill the form, the observation form completely, the facility, the primary care clinic, the area of the clinic I am going to assess, the timing, and we will go through this in details. Here I have each column represent health care workers, different healthcare workers. We are going to assess nurses, we are going to assess doctors, we are going to assess other healthcare professional technicians or auxiliary. So each column represents one category of healthcare worker. At the same time, when I am doing observation, I can simultaneously observe no more than 3 persons. Yeah, it is advisable to simultaneously observe, don't to observe more than 3 persons. The maximum 3 persons to be observed. Here, we can see clearly the form. This is the form. Professional category. Professional category. Professional category. 4 professional categories. I can put here doctors, nurses, other healthcare professional, auxiliary. Here, this is the opportunity, the moment I should do hand hygiene. This is the action. He did hand rub or hand wash or mist. This is the indication for hand hygiene. So, when I am going to record the information, I have to determine the following. I have to determine the setting. Setting, what area I am going to assess. The area I am going to assess. Maybe diabetes clinic, phlebotomy area, dressing clinic, emergency area, vaccination rooms. And I have to put the healthcare, the categories. I am going to observe the professional categories. I'm going to observe nurses, doctors, what is available at that time of observation. And the sample size for the number of opportunities to calculate hand hygiene compliance, we need 200 opportunity. The session, the time at which I am going to observe the healthcare workers during their work is about 30 minutes. So let us summarize. Who will do observation for hand hygiene compliance is one of the members of the team for the primary healthcare for implementation of infection control strategies. How many times we will do it per year? Twice. This is according to strategic plan. Session, the timing for each observation is about 30 minutes. The area will be observed is the setting, all the clinics or all the areas at which there is care given to the patient. I am going to assess all the healthcare professionals present and working in the clinic during their work. I have to satisfy 200 opportunity total, and I have to understand very well the indication of hand hygiene, the 5 moments, WHO 5 moments, because it equals the indications for which we have to do hand hygiene to interrupt the cycle of transmission. After we did observation as one of the very important items to assess compliance of healthcare worker to the hand hygiene program, we will go to the 4th pillar for our program. We have to put reminders in the workplace everywhere not everywhere, in certain areas at point of care, beside the sinks, at area at which there is care given to the patient. Why? To remind healthcare worker and help them to remember what's meant by 5 moments, to remember the steps of the hand hygiene. These are part of reminders, hand wash, hand rub, 5 moments. The 5th pillar for our program is not applied in healthcare, in primary healthcare. It's applied in hospital setting. نرجع نقول مين اللي هيعمل بالنسبة لنا assessment لمدى التزام الفريق الطبي ببرنامج نظافة الأيدي. مسؤولية مين دي؟ دي مسؤولية الأعضاء الموجودين في الفريق المشكل لكل مركز. بيحددوا شخص منهم بيتفقوا عليه، نعمل من خلاله تقييم لمدى التزام الفريق الصحي ببرنامج نظافة الأيدي. بنستخدم الفورمات اللي موجودة الخاصة بملاحظة نظافة الأيدي، بملاحظة مدى التزام الطاقم الطبي بنظافة الأيدي. بنعمل ملاحظة لكل الأعضاء الفريق الصحي مرتين في السنة، وده مذكور في الخطة الاستراتيجية. بنعمله لمدة نص ساعة كل سيشن، أو كل وقت بيتعمل مدة نص ساعة. لازم نبقى مركزين تماما وحافظين تماما وفاهمين كويس قوي ماذا يعني باللحظات الخمس لنظافة الأيدي قبل لمس المريض، وقبل الإجراء أي إجراء بنلمس في الأغشية المخاطية للمريض، وبعد ما بنلبس الأغشية المخاطية أو بعد ما نتعرض لسوائل الجسم أو للدم، وبعد ما بنلبس العيان أو بنعمل أي إجراء طبي للعيان وللمريض، وبعد ما بنلبس البيئة المحيطة بالمريض. دي اللحظات الخمس المفروض ان احنا على اساسها بنقيم مدى التزام الفريق الطبي الموجود من الاطباء، من تمريض، من فنيين، بعمل تنظيف وتطهير للايدي، سواء باستخدام الكحول، المطهر الكحولي، او الصابون وتجفيف الايدي بالكلينكس او التيشو بيبر. ولازم ألاحظ لا أتدخل أثناء الملاحظة في عمل الطبيب أو عمل الممرضة، ولا أعرف عن أسجل اسم الطبيب الذي لم أو الممرضة أو أعضاء الفريق الصحي الذي لم يلتزم بنظافة الأيدي. بنحتفظ بالاسم confidential. بعدها بنحسب لما بنوصل ل 200 opportunity أو 200 فرصة، بنحسب التزام الفريق الطبي نسبة التزامه، بنقسم الاكشنز التي تمت او مدى التزامهم او كم واحد قام بتنظيف وتطهير الايدي على المفروض ان كان يقوم به من تنظيف وتطهير الايدي، او على الاوبورتيونيتيز زي ما بيقولها بنحسب من خلالها البرسنتج اوف كومبلاينس، ونعرضها بعد كده على الفريق الصحي عندنا على اساس نحسن من هذه النسبة، وبنعرضها على رئيس المركز، ونتبع الخطة الاستراتيجية وإن احنا نضعها في التقرير، وبنعمل خطط للتحسين إذا كانت قليلة. Thank you very much for your attendance. شكرا جزيلا.
يعطيكم العافية متدربين، وإذا كان هناك أي سؤال تقدرون تسجلون كما بالسابق في شات الميتنج. إن شاء الله تكون الدكتورة نجلة الرد على جميع أسئلتكم واستفساراتكم. كما أود التنويه على أن تم وضع رابط الفورم الخاص بتقييم الدورة لهذا اليوم، وملاحظة مهمة جدا كتابة الاسم كما سيظهر في الشهادة، يعني الاسم اللي أنت تكتبه هو الاسم اللي راح يظهر بالشهادة عندكم بإذن الله. وعندكم الرابط موجود في شات الميتنج تقدرون تشوفونه وتتابعون من خلاله. وإحنا راح نظل مع دكتورة نجلة عساها القوة، ما قصرتي دكتورة، نتابع معاها الأسئلة المطروحة منكم في شات الميتنج.
التقييم سيتم نشر بعض المحاضرات. تمام. من الأسئلة. So the question, thank you, Doctor, for the informative lecture. I have a question. Do we do the observation form before or after training our team? Also, after the compliance calculation is done, what percentage is considered acceptable and what percentage is considered as poor compliance? Very good question. Let us to answer the first part. We have to follow for the observation. We will implement it before or after training of our team. We will follow the strategic plan. After finishing the training, we will go through evaluation of compliance of the medical team. Regarding the percentage, the WHO accepted percentage is 75%, and we have to increase above this percentage, and we are expecting more from primary care to reach more than this by far. where we can get forms to observe, where can get recorded lectures and text, please. For the question regarding the forms for observation, it's already sent with the head of each team in each clinic. There is package in one bag sent containing these observation forms, and as we know, the lectures will be recorded and sent. Okay. There is one question saying, once we have the compliance percentage, how do we proceed to the next step? As we said in the lecture, if I have the compliance percentage, I have to report it to the healthcare worker to show them their compliance. I have to show them there is improvement in their compliance, or there is areas needs improvement. The head of the team should be aware of this compliance. The head of the center should be aware of this compliance percentage. Reports also will be sent through the proper channel to the head of the primary care unit. Then we have to work on this compliance to see what is the percentage. Is above 75% or less than 5%? What is the area of improvements? How can I do plan? I have to do improvement plan to improve all of these percentage, and how to implement it, who will do it, and the objective to raise the percentage by how much, how you will do training, to whom you will go do training. All of this should be implemented to improve the hand hygiene compliance percentage. If we need to contact one of the representative of the Infection Control Directorate, how could we contact, please? If you need any technical support for the strategic plan and the whole implemented program, you can contact the infection control doctor or infection control team of the corresponding regional infection control doctor in your area. عفوا دكتورة، حضرتك ذكرتي وقت كتابة الملاحظات يتم ذكر اسم الطبيب أو الممرض أم لا؟ لأن الصوت قطع وقتها. يتم ذكر اسم الشخص الذي يقوم بعملية الملاحظة أو يقوم بعملية التقييم، بيكتب الانيشيالز الخاصة به، بيكتب اسمه الأول. لكن الطبيب الذي أقوم بتقييمه أو الممرض الذي أقوم بتقييمه لا يتم ذكر اسمه. Keep it confidential. لا يتم ذكر اسمه. Also, another question. Also, do we do a total percentage of both doctors, nurses together in one calculation, or do we have to do them separately? Actually, we do everything. We do separately. First, compliance of doctors, compliance of nurses, compliance of technicians, compliance of auxiliary, and compliance total. So we can compare. I can compare compliance of doctors in each clinic together. I can compare doctors with nurses. I can compare the total compliance of certain clinics together. I can compare when I do it twice annually, the first assessment and the second assessment. So you can do it separately and you can do it as total.